Maurice Emiola. I'm the WCO IPR Health and Safety Program Managers, and I will share with you the WCO stop operations. Stop operation is linked to COVID-19 medicines and medical supplies. And first, I will give you a quick overview on what we are doing in WCO. Sorry, okay. I will present you quickly the work of some organization. And after the WCO IPR Health and Safety Program, Operation Stop, the challenges and the way forward. But before to start, I would like to back on the questions raised by participants regarding how they can punish the crime related to medicines infringement. It's very important for the custom administration to know that, as Nathan said, criminals, they prefer to deal with medicine because the punishment is not so great. And now today we have an international convention which we call Medicrime Conventions. With this convention, some countries start to punish and to punish the crime related to the pharmaceutical related to medicines. And I will back on that to give you some good practice, some country who already start to punish this kind of crime. The work of some organization, we have 183 members around the world, and we have 6 regions around the world. Our main role is to facilitate the trade for our members, and also we work closely on to how to protect society, the public, the health and the safety. And also we work closely to combat the crime and terrorism. Regarding this presentation, I will focus on our role on how we are protecting the society during this COVID-19 crisis. And our program, the program who are dealing with how to protect the society is the IPR Health and Safety Program. And we have several activities. We have 5 pillars in this program, namely capacity building. We have capacity building for our members, 5-day training. But with the COVID-19 situation, we have now set up some online training with our member, 3 days online on IP with the participation of the right holders. We have several tools. I will back on one of these tools, which we call the IPR CENTCOM for the exchange of informations. We have also the awareness campaigns to share knowledge with the custom, especially with the right holder, to better equip the custom officer on how they can make distinction between genuine and fake medicine or other goods. We have also cooperation. Cooperation is a key factor to deal with IP crime. Cooperation with right holder, but also cooperation with other organizations like Interpol, Europol, IPO, and other international organizations. Last but not least is the operations. Operation can help custom to have a great view, an overview on what happens around the world or in a region or in a country regarding the trend, regarding the illicit trafficking, not especially linked to COVID-19, but also other trends linked to tobacco, excise goods, and is what we are doing. We have several operations in Asia region, in Africa region, in America, but now the operation we have now, which we call Stop Operation, is a global operations. And I will give you more detail, more insight on this. Okay, when the COVID-19 crisis started, we receive a lot of feedback from our members that there are some cases of illicit trade linked to, they say, medicines, they say fake masks, they say fake thermometer or COVID test kits. And at WCO, when we receive this feedback from our member, we make some assessments on how WCO can contribute to mitigate the effects of this pandemic, because as the government, as the doctor are working, the scientists are working to stop the effect of this crisis. The criminal, as the previous speaker said, they took this into opportunity for their criminal activity to sell fake medicines, fake mask, fake COVID test kit, and other goods related to the pandemics. And as custom, our role is to protect the society. It's what we did in WCO with Operation Stop. And when we receive this kind of information from our member, the first work from WCO is to facilitate the movement of relief goods, to not stop the movement of the good around the world. But in other side, we need to stop illicit traffic linked to COVID-19. It's why we set up Stop Operation. Then Stop Operation was set up in May to July, 11 May to 12 July last years. It was the custom response, emergency response to the illicit trafficking linked to COVID-19. And we have 99 custom administration who participate in this operation around the world. We have some ASEAN and Asia and Pacific region. We have Europe region, Africa, America. All our members take part in this operation. Even it was a very critical time because most of the country are in lockdown. Most of them, operational unit cannot perform because they cannot go on the field to make check-in. But we try to improve the custom knowledge. We try to help them on how they can perform during this operation. We have also the support from international organizations like OLAF, like Interpol, Europol, UNODC, who support WCO if it is an investigation or other matters to improve custom performance during this operation. Last but not least, we have the private sectors during this operation. Namely, we have the pharmaceutical companies who have some medicines to prevent or to cure the COVID-19 crisis. But yeah, they help us to hold some webinar to improve the custom officer knowledge on how they can better make improvement in the medicine like azithromycin, hydroxychloroquine, and others. And that was very useful to perform during the operations. The scope of the operation was the medicines. The main scope was the medicines, but also the medical supplies, COVID test kits, sanitary gel, mask, Google thermometer, and others. Before to set up the operations, we make some risk indicator in the operation plan to our members to help them to not stop the legitimate trade, but to have a good targeting to stop the illicit trade. It's why we make in WCO the COVID-19 checklist for the frontline officer. We have also some module from UNODC who was very helpful for the custom officer during this operation. But also in a weekly manner, we have some newsletters which can help the members to have a view during 1 week of the operation, what happened in this region or in this member administration. Also, we received some notice from our partners from private sector like Novartis, some notes on hydroxychloroquine or azithromycin or the dexamethasone. You may recall that these kind of medicine were very useful in some country to prevent or to cure the COVID-19 pandemic. And this note can help custom to improve their knowledge on these medicines. Also, communications during the operation is very essential. It's why at the beginning of the pandemic, WCO create a new tool to exchange information among the members. This tool we call the IPR CELCOM. And today we have 158 members, member administration in this platform with more than 500 national contact points in this group, which is a very useful tool. In this tool, you can send alerts, you can send a risk indicator, but also you can have a look on the seizure from other members. This can help you, this can help other members to improve the risk analysis to refine their risk indicators. And nowadays, the tool is very useful. We have also our partners like Interpol, like Europol, Olaf in this tool, and we can make some exchange of information in real time with this very secure tool. The outcome of the operations. We record more than 1,063 seizures reported by 51 members during the operation. That is a very great successful operation. Regarding the medicine, we seize or intercept more than 300 million illicit medicines, counterfeit or substandard medicine across around the world. We seize more than 447 million of medical supplies and also 2 million liters of sanitary gel during these operations. I will share with you some interesting cases. You can see that is COVID-19 device, a kit test, who was seized by one of the members during these operations. This is some face masks, a huge quantity of face masks seized by Benin Customs Administration during Stop 1 operations. This is some gel seized by Qatar Customs. And to circumvent custom attention, in the custom declaration, they put some motor equipment. They don't put sanitary gel because during this COVID pandemic, you need to request some health authority authorization, and to distract custom administration and custom attention, they can put other goods instead of gel or mask or COVID-19 case. That is what we saw during this first stop operation regarding the medical supplies. Regarding the medicines, we received a lot of seizure. I said it was more than 300 million of piece of medicines. This is the first dexamethasone seized by Niger Customs Administration after an intelligence received by the patrol unit of Niamey Customs Administrations. This case is some China medicines supposed to cure or to prevent the COVID-19, but in the custom declaration says by Portugal Custom. In the custom declaration, it was said that it's a Lapland, but after good risk management, risk assessment, these goods were seized by our colleague in Portuguese. This Caesar is a COVID cure. This medicine don't receive any authorization from the health authority in Cameroon, but the good was transported in the country to as some medicine who can cure the COVID-19. And here is some expired medicine seized by Dominican Customs Administration. as my previous colleague says, what we saw during the stop one operation and also in the second operation is the small parcels. Small parcels remain a challenge for custom administrations. And more than 57 cases were reported linked to small parcels during the operation stop. And I would like to open the floor now to the participants regarding these cases, these interesting cases. It's 3 cases, but I would like to ask you if you have an idea on this kind of mask, if you have some feeling. It's a 3 different Seizures. The 2 one from it was some face mask from UK. The third one is from Lithuania. But can you imagine something regarding these small parcel Seizures? You can see small parcel. We receive a lot of Seizures related to small parcels, and this, yes, during the COVID-19 crisis, it was the face mask was the main medical device imported by the members. And you can see the first Seizure, this mask was not a simple mask, but this mask, it was with some cocaine, hidden with some cocaine, seized by our colleagues in United Kingdom. You can see what criminal can do during this pandemic. Even the government are doing some great effort to mitigate the pandemic effect. This criminal can take some face mask and put cocaine in this to circumvent custom administration. And this was a very great Seizure made by our colleagues in small parcels in a hetero, not hetero, but in an airport in United Kingdom. And to have an overview on the Seizure during this stop operation, this is a summary of the Seizure. Most of the Seizure of medicine coming from Africa, more than 99% it was in Africa, the medicines. The face mask was seized in Europe, the gel in North and Middle East, the COVID test kit also in Europe. And it's to say that, to share with you that stop operation was a great barometer on the illicit trend around the world during this COVID-19 crisis. And the threat is around the world. No country is not protect against this criminal activity during COVID-19 pandemic. And after this great results, is important for custom to have a great risk profiling and intelligence also. Yeah, for sure, we receive a lot of Seizure from routine control, but risk management, risk assessment is very important. The cases I share with you regarding the Portugal cases, where some medicine were declared as a lab plant, it was with risk profiling. Risk profiling is very important for customs. And then after stop one operation, because when we complete the operation in July, the vaccine are not yet approved, but just after stop one operation, the health authority around the world approved the COVID-19 vaccine around the world. And we make assessment to set up another operation, which code name is Stop 2 operation. Now, Stop 2 operation is in progress because we start last in April, and it will be completed in September. Stop 2 operations, to date, we have 145 members, 145 custom administration around the world. That is a great, very great operation. And also we have our partners, the main partner, Europol, Interpol, OLAF, UNODC, and World Health Organizations. What we did prior the operation is to have some webinar with our cost frontline officer. And this webinar was made by Pfizer, AstraZeneca, Moderna, Johnson & Johnson, Sinopharm, India Serum Institute. And then the next one will be Sinopharm in July. If you go on the WCO website, you can register to attend this kind of webinar. And to date, we complete the first phase of this operation, and we already said some COVID-19 vaccines. We already said a lot of medicine, medical supplies, and other goods linked to COVID-19 during this operation. I cannot give a lot of details as the operation is still in progress, but I can tell that we have in total 55 million pieces in 2 months of operation, 55 pieces of goods, medicine and medical supply sales during this operation. And our members, they are really, really active in these operations. The main challenges, Nathan already talked about the legal, the transit and filtering zone, small parcels, and the lack of risk management. But also, it's the legal framework and process in some country and some custom administration who don't have ex officio to take action where there is a seizure. It's very important to improve, to have a very good legal framework and process to perform when it's become the IP issues. The way forward is to better have an inter-agency collaborations, to have IPR risk management related in the custom clearance system, because a lot of members, due to the review collection, who is a high priority in some region or in some country, they don't take into account the risk management related to IPR in their risk management system. It's very important for that. And also, intelligence sharing. It's important to share intelligence, especially when you are custom. Today, we have a very good tool, which name is the IPR CENTCOM tool to share intelligence. Also, collaboration between custom and right holder, the private sector, is very important to improve this collaboration. Last but not least is the investigations. It's what we are doing now in WCO. Yes, it's good to have a seizure, but it's better to make some investigation after the seizure. And in WCO, we have the COPES program and also the anti-money laundering program, who are helping our members to improve their legal framework, to improve their knowledge regarding how they can make intelligence, better investigation with IP crime. Thank you very much for your attention.